Good morning, everybody. I'm Dr. Hal Blatman, Medical Director at the Blatman Health and Wellness Center, based in Cincinnati, Ohio. And I'm here today with,
I'm Clint, Cornell. I'm a physician assistant and health educator with the Next Direct Primary Care Network, also
also
located
in
in
the Cincinnati
Cincinnati.
area.
Yeah.
So we're going to chat today about thyroid. And one of the things that is real important is, how would you know that your thyroid is low? How would you know it's not functioning as well? How would you know that you even need to investigate this question? So what are the main things that people should know about how to find out that their thyroid is low?
Yeah, we see people come in with very vague symptoms. They can include brittle nails, dry hair, brittle hair, thinning hair, fatigue, weird skin rashes, difficulty losing weight, brain fog. Those are a few of the common symptoms that we see.
Agreed. And the things that really just spark to thyroid, because some of those things on the list could be multitudes of issues, but the ones that really sing to the thyroid song are the fingernails chip and crack, or they're really thin and don't grow. Hair gets brittle and starts to fall out. The skin is really dry, and some people say, well, my skin isn't dry. Well, do you put lotion on? Yeah, I put lotion on it every day. Well, why? Well, because it's dry, and especially the bottoms of the feet crack in the wintertime. So if those things are happening to you, your thyroid is low. Well, some people, their doctors tested them for their thyroid, and so their doctors told them they're normal. Let's and let's talk about that controversy for just a few minutes.
Well, Dr. Blatman, one of my favorite things to treat and investigate with patients is this topic of thyroid disruption. And we know that in traditional medicine, when we go through medical school or medical training and residency and so forth, we're taught to look at a couple of lab values. And if the patient's numbers are within a certain range, then we're taught that the thyroid is working the way it's supposed to work. But the thyroid pathway is so much more complicated than just a couple of numbers on a lab test. Most people, if they've had their thyroid checked, have probably heard of a test called a TSH, and that stands for thyroid stimulating hormone. And it comes from the brain when the brain detects that there's not enough thyroid hormone in the blood. And we can get into this a little more this morning, but there's so much more going on with the thyroid pathway that when we just simply look at the TSH lab test, we are really being short-sighted, and we oftentimes miss underlying thyroid pathology.
Right. So when I do a thyroid lab, we already know that your thyroid is low. We're not doing the lab test to see if you're low. We're doing the lab test to make sure it's safe to give you thyroid hormone as an experiment. And basically, anytime your doctor prescribes a medicine for you, he's doing an experiment and you are the lab rat. And what we want to know is, if we do a thyroid test and your thyroid numbers come up really high, then it's not safe to give you thyroid medicine. Something's really wrong, and maybe we need to look down deeper and find out what else is going on, or maybe you even need an endocrinologist. But if your thyroid levels are anywhere close to the normal range, not high, middle range, low, even sometimes high middle range, we'll still give you some thyroid medicine and see what happens to you. And if your fingernails correct, your hair corrects, your skin corrects, it's not dry, you don't have to put lotion on every day anymore. If those things happen to you, then we know that your thyroid level is probably pretty close. And then we do a lab test and make sure that what we've done is safe. In that fashion, we can do responsible thyroid care. And another, piece that people come in with is, my doctor has me on thyroid medicine. And usually it's going to be Synthroid or levothyroxine. They're the same thing. And once you're on thyroid medicine, you think everything is corrected and treated. But even if you're on thyroid medicine, if your hair, skin, and nails aren't right, thyroid medicine isn't working right. And that's more the point. And what we find is that Synthroid doesn't work that well. Sometimes it works fine, numbers are fine, skin, hair, nails are fine, but how many times do you see, Clint, people with taking Synthroid and taking thyroid medicine, and they still have an abnormal thyroid or abnormal thyroid function?
I would bet that more often than not, when a patient comes in and I see that they're on Synthroid or levothyroxine, if I make the bet that their symptoms aren't controlled on that, more often than not, I'm correct. And I think really what you're pointing out is this notion that in medicine we treat patients and symptoms, not numbers on a lab test. People aren't a number on a lab test. They're individuals with symptoms and physical exam findings and histories. And part of thyroid treatment, probably the majority of thyroid treatment, is digging into those symptoms. And as we were talking, one of the main symptoms we often see with thyroid is this idea of cold intolerance. People who are always just a little cold, they can't get warm enough. That's another one that comes to mind. But when we talk about medication, I think it's helpful to understand that the thyroid hormone really comes in several different forms. There's an inactive form that the thyroid produces. We call that T4. And it's this T4 or inactive thyroid that is the medication form. That's the levothyroxine or Synthroid. The body has to take that inactive form of thyroid and convert it to something called T3, which is the active form. It's the T3 that binds with the receptor and does the work, so to speak. And so if you aren't able to convert the T4, the inactive form, to an active form, well, your blood levels might look okay, but your symptoms aren't going to improve.
Exactly right. And so you walk around with a blood level that's relatively normal. Your doctor looks at it and says, well, your thyroid is normal. And you look at him and go, well, my skin isn't right, my nails aren't right, my hair isn't right. What is the deal? And so we, long time ago, got into a very good habit of treating the person rather than treating the lab test. And there's other things that can throw that lab test off. Like one of the things we test often is thyroid antibodies. You can have high levels of thyroid hormone and your immune system is taking it out of circulation and not letting it do its job. So the numbers have all kinds of reasons to not be effective. And you can't measure thyroid function by just measuring blood levels, because that doesn't tell you the whole story of what's going on. And then you mentioned temperature. Let's talk about that for a minute. That's not something you can always just correct by taking Synthroid or taking thyroid medicine, but how many people do you see whose normal so-called body temperature is 97? And weren't we taught that normal is 98.6? Can you address that?
Yeah, there's a high proportion of people who come in, and we'll catch this when we do their vital signs in the office. You'll measure a temperature and they're 96.8 or 97.4, or whatever the number might be, but it's consistently lower than that normal temperature that we're taught to look for. And one of the old-fashioned ways of diagnosing an underactive thyroid is actually to have a patient measure their basal body temperature over a period of days and track that. And we still use that technique today. So temperature is a very critical part of evaluating the thyroid.
But temperature doesn't always come up when you're taking thyroid medicine. A lot of people with normal functioning thyroid medicine, hair, skin, nails, and so forth, and their temperature is still 97. And so what we say to these people is that 97 is never normal. It might be what you run at, but you're supposed to run at 98.6. And the reason for that is that most everything in our body happens by chemical reactions of one form or another. And if these chemical reactions were left on their own to go at their own pace, everything would happen really slowly in our body. So if our temperature is below 98.6, all the chemical reactions in our body happen slower. And the chemical reactions in our body don't happen at their own pace. They're all catalyzed by something we call enzymes. And enzymes are often vitamins that we take. And these enzymes allow chemical reactions to happen very, very quickly. But all these enzymes in our body have an optimum operating temperature, which happens to be 98.6. So if your body is running at 97, that means all of the chemical reactions in your body, including the ones that help you heal, are all running slower. So if your body's running slower and your metabolism is a little slower and you'd like to speed that up, one of the things you can do is look up Wilson's syndrome. Look it up online. Do you know much about that, Clint?
You know, Dr. Blatman, I'm familiar with it, but I'll let you elaborate more.
So Wilson's syndrome, you can look that up online, and you can download or buy and purchase the physician manual of how to treat it and the patient manual of how to treat it. And I would suggest you get the patient manual and look through that, because that will tell you what correcting this is going to take. And it usually takes a few months of cycling T3, low doses, and then raising the dose, and then bring the dose back down again, all with the purpose of correcting your body temperature and getting it back up to 98.6. We've done this a few times. It's not a comfortable process. It's not a particularly uncomfortable process. It does take a few months, and you can reset your body temperature back up to 98.6 if you're tired of running at 97 and you're willing to go through the 3 months of what it takes to reset that. All right, let's talk about some of the brilliance. Why the brilliance of the biologic design of T3 and T4. You mentioned that T4 is produced by the thyroid gland, and then the body has to convert that to T3. Well, the brilliance of that is that if the body's thyroid gland, which is right here in your neck, put out active thyroid, then all of the body parts close to here would get a lot of it, and all the body parts far away, like your fingers and your toes, they would get it last, and there might not even be any by the time the thyroid hormone gets to them, right? So the thyroid T4 gets secreted by your thyroid, circulates all over your body, and your body converts it when it gets to where it needs to be. So everything in your body gets thyroid at the same time and gets enough of it, because it converts in your big toe the same rate it converts in your fingers, converts close to your thyroid. So distance from thyroid doesn't make any difference. And that's one of the brilliant things in design about why and how the body does that. What do you most often prescribe? We've just spoken about how Synthroid doesn't work. Levothyroxine in many people just doesn't work. So what do you use instead?
Well, you know, when you brought up the Wilson's protocol, one of the reasons that I defer that over to you, I haven't used it in a long time, because it's a very difficult protocol, and it's hard on the patient, and it's a lot of work. And so we find that it's not very many folks who are willing to or able to go through that successfully. But if you have the right patient and they're motivated, you're right, that can be very effective. What we tend to look at in terms of treatment, especially our medication options, is a product that has an amount of the T4, the inactive thyroid hormone, but also one that contains the active thyroid hormone, the T3. And our preference is something called Armour Thyroid. And actually, this was a little tidbit that I picked up hanging out with you, is because the Armour Thyroid comes from a pig source. You get that messenger RNA that, you know, every once in a while it might help rejuvenate the thyroid gland. So I found that was very interesting. We always went with Armour as a first-line therapy because it had both inactive and active thyroid hormone. But that messenger RNA tidbit, I think, just reinforced that choice even more.
How do you know you're getting too much thyroid?
Well, again, we go back to symptoms. So if someone's starting to feel like they have tremors or shakes, or they're anxious, or their heart rate is too high, um, if they're feeling excessively warm, hot, um, those are signs that your thyroid level is too high, and we'll back off.
Agreed.
Yeah.
Agreed. And so when we give people their first doses of thyroid, we're really doing an experiment. And the person is essentially the lab test. And so if your thyroid levels are right, your hair, skin, and nails correct. If your thyroid levels are too high, then you get an uncomfortable beating in your chest. Your heart goes a little too fast. It's not dangerous. It's not something to worry about, but it's not comfortable. And as soon as you stop and bring your thyroid levels back down, it goes away just in a few hours and you don't use that dose again. I rarely see that happen, but that's your safeguard. So that's how you can tell if your thyroid is too high. If it's too low, you're looking at your hair, skin, and nails. If you're taking thyroid medicine and you're still putting lotion on the bottoms of your feet and your heels are still cracking, your thyroid isn't up to snuff, and the medicine you're taking isn't working really well. And then there are some people, just like we were just talking about, who come in and tell me, doc, I haven't seen you in a while, and I need to let you know about this thyroid thing. About 6 months ago, I started to feel those palpitations in my chest, so I lowered my dose, and it went away just like you said it would. And 2 months later, it came back, and I lowered my dose again. Well, I got to tell you, I haven't taken any thyroid medicine in the last 2 months, and my hair, skin, and nails are just fine. And that's what we're talking about. The messenger RNA in the pig parts that are included in the T3, T4 preparation actually helps your thyroid gland rejuvenate itself and take back over again. So that never happens with levothyroxine, but I've seen it happen a number of times with these other preparations. And there's a few, there's more than just Armour Thyroid, and they're all made basically the same way. Some of them are dairy-free, some of them are gluten-free, not all of them are everything. It depends on the fillers and how it's all put together. But you can look at and research the particulars of that. Another thing I'd like to discuss before we quit is, how often do you take the medicine? Like, there are so many people who come in and they're taking Armour Thyroid or one of the others, and they're taking it once a day. And I really need to let everybody know, this is not a once-a-day drug. This is a twice-a-day drug. And your dose should be even. What you're trying to avoid is a big peak blood level, a high peak from a dose that was taken once a day, and then you're without it when that goes away for the whole rest of the 24-hour cycle. So it should be at least taken twice a day. And if your dose is getting higher than that, you don't take 2 in the morning and 1 at night, or 1 in the morning and 2 at night. If you can't take 1.5 morning and evening, then you take 1 about every 8 hours and divide that up. And you try to even it out as much as you can. And then we have 2 more questions. One is, do you have to take it the same time every day? And do you always have to take it on an empty stomach? Because we hear both of those things a lot with thyroid preparation. What do you tell your folks?
So we tell them to try to take it as consistently as they can. And we also tell them to try to take it on an empty stomach, at least 2 hours fasting.
All right, and that's what a lot of folks say. But I have a more practical approach to it. I take my first one in the morning on an empty stomach, and I do that every morning. But I don't wake up every day at the same time, because, I might take my weekday when I'm going to the office at 6 o'clock in the morning. I'm not waking up that early on Saturday and Sunday unless there's something that I need to wake up for. So if I wake up at 8 or 9 o'clock, that's when I'm going to take my thyroid on an empty stomach. And then my next one, because I'm on a 3 times a day schedule, my next one is about 8 hours later, And sometimes I remember, and sometimes I don't. And when I don't remember, then instead of 2 o'clock in the afternoon, it turns out to be 6 o'clock at night as I'm leaving my office. And I go, oh, I forgot my thyroid today. I'll go take my second dose now. Well, it's not exactly at the 8 hours, but here's the point. Do you think the little man in your thyroid gland who gets the message from up here that he's supposed to release the thyroid, do you think he ever looks at his watch and goes, wait on it, not yet, go? It doesn't do that. So we know that the thyroid gland pulses. We know that it secretes into bloodstream, but we don't know what makes it trigger to pulse now versus an hour from now. So as long as you get the dose in that your body needs for the day, your body can figure out the little things that are in between and different. And it's okay to miss by an hour or miss by 2 hours or even miss by 3, because what you're really trying to avoid is taking 2 of them at the same time and having a peak blood level that shuts down your biofeedback mechanisms that you need. So you don't overpower your biology. And that's why you divide it and do it in divided doses. Yeah, you can make it for a while taking it once a day, but usually in about a year, sometimes 2 years, sometimes even way sooner, depending on how big that dose is, your thyroid is not going to work. And here you are taking the medicine, your blood levels are maybe sky high because now it depends when you test, and you still have thyroid symptoms because that once a day doesn't correct you. So let's talk about empty stomach versus full stomach, and then let's talk about when to test. So I take the first one on an empty stomach because that's first thing in the morning. But my other ones, not necessarily so. And if you forget to take the one before dinner, then take it after dinner because you still need it. And your body, it will absorb more slowly. You might not absorb quite as much, but you're still getting it into your body, and your body will figure out some of the differences. And it's not worth making you crazy to make sure you go 2 hours before, 1 hour after, whatever that number is. That's enough to make you goofy during the daytime. So I try to tell people, just, you'll know you're doing right by your hair, skin, and nails. And as long as you're close enough and have good enough thyroid, your body will give you the right answers. So one more, let's talk about when to test. So you're at your doctor's office and your doctor says, let's test your thyroid. Is that ever the right answer? And I'm going to tell you no. So when do you send your patients for test?
So we usually test first thing in the morning, and after a fast of at least.
Well, we don't do it that way. We do the test midway between doses. If you're supposed to be taking it 3 times a day, that's roughly 8 hours, then we want to test you 4 hours after your empty stomach dose. If you're taking it every 12 hours or supposed to be taking it twice a day, then we want to test you at 6 hours after your morning dose. If you test in the morning before your dose, your levels are going to be really low because your last pill was 12 hours ago. If you test right after your morning dose, your levels are going to be sky high. So that's not the right answer either. You want to know where you are midway through the day. You don't want the peak. You don't want the trough. You want to know where you are in the middle. And that is midway between your doses. If you're taking it every 8 hours, it's at 4. If you're taking it every 12 hours, it's at 6. That gives you a level that you can understand. And if you are taking my thyroid medicine and your family doctor orders a thyroid test and you do it 2 hours after you take your thyroid medicine, your levels are going to be really too high, and your doctor isn't going to give you the right answer. He's going to lower your medicine. And that's not the right answer either. So those are the things that are critical. Don't take it all at once, and make sure your lab test is timed. All right.
Okay, Dr. Blatman, if you could pick a number between 1 and 3, we're going to be awarding someone lifted infused tea samplers.
Let's pick 3.
Sylvia, congratulations. This is Taslima. She's the creator of Lifted Teas. And you can find her products at symbol Lifted LFTD Infused Tea. And that's on Instagram and Facebook. So Sylvia, you're the winner today. Is she
All
there?
right. She's here. She's here. She's muted. Let me see. I can unmute her. Does all this have an effect on your liver and your white blood cells being low? I don't know. I've not heard an effect on liver and white blood cells being low. I'd be looking for something other than thyroid. Have you seen thyroid issues? Low thyroid affecting white blood cells and liver?
No, there's no correlation that I'm aware of. Thyroid really is so much to do about metabolic rate and energy production in the cell. Not much correlation with white blood cell count.
But Sylvia, your issues of dry, itchy skin, cold off and on, and fatigue could certainly be related to thyroid. And once a day is not the right answer. And so now now you can correct that. So take it twice a day. And if you need a bigger dose, then if you can't split it in half, then you take it 3 times a day. All right. Well, I'm really glad we did thyroid.
Okay.
That's all.
Sylvia, you may reach out to me at Dr. Tranquility, Lydia on Instagram, or Taz directly at Lifted Teas, and you will get your sampler at Lifted LFTD Infused Tea, and we will make sure you get your sampler. Okay.
Right. Well, thanks everybody. Have a wonderful day. We'll pick a topic for next week, and we'll see you next Saturday morning. Bye now.